Hi, I'm Katie Hinkst. I'm one of the optometrists here at Enclave Vision Associates, and I wanted to talk a little bit today about dry eye disease and specifically how Meibomian glands affect our dry eye disease. If you have found your way here to this video, it is likely that either Dr. Montgomery and I have talked with you in your exam about dry eyes and how we can alleviate some of those symptoms. And so I want to talk about first, what are the Meibomian glands? So Meibomian glands are small little glands that are along the waterline of our upper and lower eyelids, and they produce a substance called meibum, which is very similar to kind of like an oily-like substance. So that meibum's job is to be on the very front surface of our eye, and it creates almost kind of like a sticky layer for the water layer of our tears to stick to. What happens is, for a lot of us, for different reasons, those Meibomian glands become clogged. They become less functional. We call it dysfunctional Meibomian glands. And when we don't have that nice healthy layer of meibum, the water layer has nothing to stick to. And so that water layer will evaporate very quickly. And that evaporative issue will cause our vision to be inconsistent. So we'll find that if we blink, then our vision's clear for maybe a couple of seconds, but then it gets blurry again. But then the lack of the meibum in our tears also just throws off the composition. We'll get some salt buildup in our tears, it's a little saltier than it usually is supposed to be, and that will cause irritation as well. So now we can have issues ranging from just irritated red eyes to maybe some vision fluctuations. Sometimes even watery eyes can be a symptom of dry eyes. Everybody's a little bit different that way. So we want to target those Meibomian glands so that the meibum is healthier, that the meibum is being expressed from those glands in a healthy way to improve those dry eye symptoms. In the past, really the best tool that we had to offer in office was to use warm compresses at home. So to kind of send you home with the advice of use these warm compresses once a week, twice a week, kind of depending on the range of your symptoms. The warm compresses are very effective in softening that meibum that's in the glands and encouraging it to come out. And a lot of times patients see some really good improvement from this. The downside to warm compresses is it is something that you have to do on a pretty regular basis, sometimes even every day. And the warm compresses cannot really go in and improve the unhealthy Meibomian glands. So the ones that have been unhealthy for quite some time, that are really those dysfunctional glands, it doesn't really do a lot to encourage those to work better. It just makes the ones that are still healthy and still working, it encourages those to continue to produce. Sometimes there's also an antibiotic that we would recommend called doxycycline. That can sometimes also be helpful for the treatment of Meibomian gland dysfunction. But again, it's something that you're taking it on a daily basis. It's a medication that we're taking. Everything has side effects. And so now though, we're very excited to introduce the Optilight by Lumenis. And it is a new system that we have in our office that is able to address Meibomian gland dysfunction in a much more efficient way. So the Optilight is an IPL system, which is for intense pulse light. Now, IPL has been around in dermatology for decades. So since the late 90s, it has been used for dermatology type applications. The Optilight itself is the first FDA approved treatment for IPL treatment for dry eye. So it is a light-based treatment. There's no drops, no drugs involved. The Optilight is a system that we will show on another video, kind of what the whole procedure looks like. But essentially, it's a light treatment that has a handpiece that we apply in office, going across the cheekbones. Every time we have a little light pulse that comes across it. And then we also have a smaller piece that allows us to get closer to the eyelid, closer to those Meibomian glands. And so the Optilight is effective in treating Meibomian gland dysfunction in two ways. The first way is it does the same thing that a warm compress does, just on a much more efficient basis. So even though this is a light-based treatment, there is a thermal component to it. There is some heat. It's not hot, but there is some heat to it. Since we're right up there against those glands, it does a really great job of softening the meibum, encouraging the meibum to come out into our tears to encourage that healthy tear film. So that's one way that the IPL helps with Meibomian gland dysfunction. The other thing that it can do is it targets inflammation. So something that I didn't mention earlier is that with Meibomian gland dysfunction, a lot of us will get the development of abnormal blood vessels right along our eyelids. And sometimes you'll see those. People will look at their eyes, they will feel like their eyelids are very, very red. That's actually called ocular rosacea, that abnormal blood vessel growth. But those blood vessels are inflammatory. What is so great about the Optilight is that using different filters and different settings, we are able to specifically target those abnormal blood vessels to calm and quiet them so that they do not produce those inflammatory factors that feed that dry eye disease. And the added benefit of that is that it decreases the redness. So you also kind of have this nice cosmetic benefit to it. So that's the two ways that the Optilight are really able to target that meibomian gland dysfunction in ways that we really haven't been able to do before. So by softening that meibum in a very, very effective manner, but really the key is reducing those abnormal blood vessels to decrease the inflammation. That is something that we really can't do with a warm compress. It just can't be addressed. So this is very exciting. We're really glad to be able to bring this technology to our patients. If you have any questions at all for me or for Dr. Montgomery, we're open books about this. We want to know anything that you have questions about, anything else that we can address for you. We will have some other videos posted as well, as I mentioned, that will show you what the procedure looks like so you can kind of know what to expect from beginning to end, as well as probably some other videos addressing some more frequently asked questions about the Optilight dry eyes in general. But please, you know where to find us. You can give us a call, send us a text, but we would love to hear from you about any questions and let us know if you think this might be a procedure that could help you on your dry eye disease journey.